Michelle, thank you so much for allowing us to be in your office this morning and at the Wheel headquarters. Could you please give us a quick intro of yourself and what Wheel does?
Sure. I'm Michelle Davey. I'm the CEO and founder of Wheel. Wheel is everything that clinicians and companies need to deliver care virtually. So everything from the software technology to the actual clinicians that powers some of the most innovative healthcare companies. Everything from telehealth and virtual care companies, virtual primary care and urgent care, to lab and diagnostic companies, and some of the more traditional sides of healthcare as well. So we're really enabling all of these partners to deliver high quality care across 50 states, 24/7, 365, with the most innovative tools and technology, as well as the network that powers it.
Can you kind of go back to maybe the beginning days of Wheel when maybe there was a struggle or whenever there was an issue going on or when things weren't as pretty? Can you maybe give a story or an anecdote of what that was like back then?
Yeah, definitely. I mean, I think it's important to remember even when things like raising $200 million, it's never easy.
Sure.
It's never pretty under the scenes. But in the earliest days, it was really about finding that momentum early. I think there's a couple different things that I can point to. First and foremost, kind of the struggle to just get off the ground. When we were building Wheel in the beginning, this is 2018.
Right.
Telehealth, the pandemic hadn't happened. I was teaching people what telemedicine was. Telemedicine had been around for 20 plus years, but utilization was roughly about 1% of healthcare at that point.
Wow.
So it was really used for like you've got a cold or a flu or really have like urgent care needs.
Okay.
And back then when we were starting, I was telling investors or trying to pitch investors on this idea that there needed to be infrastructure to power the future of healthcare, which was virtual care. It was a struggle, especially when utilization was low. But really, for me, it was about why did we need to build it then? I think one of the stories I'll give is in the earliest fundraise days where I was teaching people what telehealth or telemedicine was. Wasn't only teaching them, but then convincing them that the world was going to look different. And I would go around telling all of the investors, this mission is going to take 10 years to realize. So you got to be with me for the long run because this isn't going to happen overnight. And that scares a lot of venture and a lot of people who want to give you money. But then literal months after raising our Series A, the pandemic happened and our phones started ringing off the hook. And that was when telehealth was really realized in a moment where the rest of the system was breaking due to this global pandemic, but telehealth and virtual care was able to fill some of those gaps. And we're really just at the beginning of that. We're just scratching the surface. I still believe it's a long journey. There's a lot to do in healthcare. But those struggles in the earliest days help us get through the struggles now and help create that momentum for the future.
You mentioned there are things that we need to do in healthcare, start changing the game, or there's a lot of steps that need to happen. What are some of those things that need to change, you think, in healthcare?
Oh, there's plenty.
maybe one or two. Then
one or two. I think there's a couple different things. I mean, you look at the way the healthcare system has evolved over the last couple years. In light of a global pandemic, a lot of things have changed and have broken. I think now's the opportunity to go back in and rethink why we were doing some things that way. Roughly 50% of Americans are underinsured or uninsured, and we're seeing skyrocketing prices of healthcare, it's the number one reason for bankruptcy in this country. So I think for us to really rethink how care is delivered, whether that's utilizing virtual care or enabling patients to get access to care on their terms, is really where we can fundamentally change the system and enable patients, no matter where you're at, no matter whether you're from a small town or a big city, you can access care. That's not only from an access perspective, from a geographic perspective, but also from a socioeconomic perspective. We all deserve care. We all deserve great care. So fundamentally, rethinking the care delivery system is what we're really trying to tackle.
I want to go back to January 19th of 2022, right? The day that it was announced that you guys raised your Series C, 150 million, if I'm correct. I want to ask you, maybe kind of go back in time with you. What were you feeling when you woke up that morning when you saw that number in Times Square? You're taking a picture near the NASDAQ, and it has the wheel 150 million. Can you kind of give me some of the emotions that you were feeling? I know it's probably cold outside, but besides that, what were you feeling and what were you thinking during that day? In the night before leading up to it?
Yeah, I mean, it's really surreal. It's surreal to come from the humble beginnings of two people in a small closet trying to build the company to standing in front of NASDAQ with your logo on it. And just really, it was everything that the company and the team had worked so hard for. It was a reward to show the rest of the world those efforts. For a founder and a CEO, we oftentimes get the limelight and say, oh, we did all of this, but it's 100% the team behind me who makes that possible, who makes all of it, us to even get to that point to raise a Series C. So I was incredibly proud of the team. It's humbling for sure to stand in the freezing cold and take a picture in front of NASDAQ. But it really made me really incredibly proud of the work that we're doing. And also, as any founder will tell you, it's also that moment where you're like, oh man, there's, you got to keep going. And what does this next phase look like? And how do we lead the team through these next couple of phases?
Were you you couldn't sleep the night before? Did you knock out because you were just so exhausted? Like the day before, probably.
So I flew into New York, and this is January 2022. So it's still COVID happening, and I flew in for 24 hours in and out. There was still a lot of pandemic response happening in the city. So we flew in. I did sleep a little bit. I wouldn't say I slept soundly, but I slept a little bit. But really with anticipation and excitement and really waiting for, like I said, the team to get the recognition that they deserve for all their hard work.
You are open and honest about your autoimmune disorder whenever you were growing up and how difficult that was to get treatment because you lived in a small town in Texas. And I would imagine the sacrifice your parents made of driving you to doctor's appointments for many years, trying to figure out, what's going on or why is my daughter feeling this way, right? How do you think that Wheel and the work you're doing with Wheel honors the sacrifice that your parents made for you?
I love that question. Recently, I was just texting my mom about thanking her for all of the time that she spent trying to help me find what was going on, really seeking the answers that we couldn't get for a really long time. Ever since I was a child, where she was shuttling me hours to the doctor's office, to even when I was a young adult, where she was the one sitting in the hospital holding my hand and saying, everything's going to be okay, we're going to figure it out. So that for me is like a huge part of why I wanted to solve the challenges of healthcare. Growing up in a rural town is great for a lot of things. Healthcare is not one of them. But what I believe that we do here at Wheel that can enable, hopefully, patients or people who have autoimmune conditions or even simpler conditions is receive access no matter where they're at on their terms. And hopefully, it's not just about getting you to a clinician, it's getting you to the right clinician. Because I had access to doctors, but they had never seen my condition before. And I don't put that on them. In a small town, you're trying to do your best. But ultimately, it's about Wheel connects patients with the right care with the right clinician. So we match a patient to a clinician on over 12 different attributes. It's not just who's available.
Okay.
It's have they seen your condition before? Are they trained in that specialty? Have we shown them or given them training to help them diagnose those conditions as well? So we really help them with their education while they're on the platform as well, so they can serve more patients. And so 100% is it a way to show my parents that not only am I thankful for that work, but that we can create something better for the next generation.
I know the mental health care is important to you, not only just as a company wheel, but personally I know that. Do you ever feel pressure to put on more because you lead this company and maybe have to put aside if you're either not feeling too well mentally or if you're not having a great day, you have to put that aside a little bit to focus on your employees and on the company? Do you ever feel that way?
I think at times, I mean, it is being a founder and a CEO and running a company, no matter the size or the scale, you do have additional pressure because not only are they looking to you for guidance or looking to you for alignment, but ultimately, you want this to be just as successful as you could imagine. And you want to reach that mission. For us, it's putting great healthcare within everyone's reach. That's a really large mission. And so there is a lot of pressure to that. But I've always been really open and honest with my team, my board, my employees about when I don't feel good and that I have an autoimmune condition, because sometimes I don't feel great and it's hard for me to maybe perform at the top of my game. But being open and transparent with them, it allows them and the people around me to support me in those times. And that for me is an incredible feeling to look around and say, I don't have to do this alone. I have an incredible board and leadership team and employees who can do this and help me through it, and quite frankly, do every single day, regardless if I am not feeling great or I'm at the top of my game.
You mentioned that you have a great board and a great leadership team behind you to walk you through things that are difficult or just to provide advice and be there for you. What do you think is the best advice that you're getting from your investors right now during this economic downturn?
I think we were very purposeful on the board that we built. And I think as founders and as you start to scale a company, as you bring in venture capital or even independent board, you really want to think about who is around the table and how they work together and how they work and believe in the mission and the work that you're doing at the company. So I'm very lucky to have put that board together and have some incredible people on it. I think the best advice I'm getting and continuously get from them is really around focus. And that's the advice I'd give any founder. It's not just right now, there's a lot happening in the world. I've been talking to the team about we have to focus on what we can control. There's a lot of external factors we can't control, but what are the things here we can focus on and focus on control? The second one is focusing on your network because it's other founders, other CEOs, board members who've been through downturns, who have seen this game play out, or maybe have lived experiences that they're experiencing right now. And sharing that information openly and being transparent with others helps us all. And I think that's really it. How do you focus on those two core things and really focus on what is the work you can do during these times? It will all come out the other side, but it will be those who are really focusing on what they can control that I believe will come out stronger.
What's maybe the worst or the not great advice that you're getting from your investors right now as well?
I don't know that there's not great advice. I think right now, like I said, with so much going on, everybody is trying to figure out what the next move is, what's going to happen with the economy, what that means for them, what that means for your company. And while it's not bad, I think we all sometimes project what's happening in our lives on other people because that's the experience we're living in that moment.
Okay.
So it's really about, again, focusing on what we can control. And, you know, we all have those moments where things are happening externally or the market has gone up and then it's gone down again. And we're all trying to guess where it's going to be in 6 months or 6 quarters. I think for the advice, you know, that's maybe not as helpful right now, going back to that focus is the name of the game, is worrying about what's going to happen in the market in 6 quarters versus worrying about what we can control now with still an outlook at the future. But nobody that I know has a crystal ball.
Yeah.
So it's really about how do we position ourselves best in light of everything that's happening. So I wouldn't say it's bad advice. It just is really finding that signal through the noise right now.
When you were pitching Wheel, a lot of investors eventually said, you're going to have your company based in Silicon Valley at some point. And we're in Austin. You've been in Austin. What would you say to some of those investors who encouraged you and said, eventually you'll have to be in San Francisco at some point?
I think most of them are actually have an office here in Austin now. So I would say welcome. I think before the pandemic, we were one of the only healthcare companies in Austin.
Right.
And so, you know, Austin wasn't really known for its healthcare. Houston's known, Dallas known, even San Antonio was well known for their healthcare. So we were hearing a lot from investors early, well, if you want a venture-backed company in healthcare, you're going to need to be in one of the central hubs, whether that's Silicon Valley or New York.
Sure.
We really need you there because that's where you can grow teams, you're closer. I really believe that being in Austin from the beginning was a competitive moat for us.
Right.
It allowed us to go to the Bay or go to the New York when I was traveling, hear the trends of the market, what was happening in real time, but come back here, put our heads down and build. Austin wasn't a place at that time where you were hearing a lot of change in trends. We were pretty solidified in the types of things we're doing here. Since the pandemic, a lot has changed. A lot of people moved to Austin. Capital moved into Austin, large capital partners. So the dynamics of the startup industry has really evolved. And now I think we all know kind of the remote world, whether that's over Zoom or a phone call, you know, we can connect to who we need to when we need to.
Michelle, again, thank you so much for this morning. Thank you for answering my questions and being open and honest. We look forward to talking to you again soon. And again, thank you so much for having the time this morning.